Across the Flow FM network, a Flow News 24 update.
In New South Wales, the Yanco Creek Modernisation project continues to take shape. It's a project that links the 800 kilometres of creek systems between the Murrumbidgee and the Murray River. The project has public consultation being undertaken, and it's part of the Sustainable Diversion Limit Adjustment Mechanism, SD-LAM, which is part of the New South Wales government's response to the Murray-Darling Basin Plan. Now, the reality of this is to keep the Yanco, Billabong Forest and Colombo Creeks flowing, but there are systems being put in place where weirs are being also looked at to be reconfigured. There are 4 weirs that are being determined for reconfiguration along the river system there, the Billabong system at Hartwood, Piccaninny, Wanganella and Carranboon weirs. And this project has a number of key points from about Narrandera, or just out of Narrandera, right through to almost Moolameen, is where a number of projects are being undertaken by the New South Wales government for what is a major Yanco Creek, but Yanco system, which includes the Billabong Creek and other associated creeks that run through our broadcast areas in the riverina of New South Wales. We take a look now at Victoria, and the first government childcare centres are taking shape. These are early childhood and pre-prep centres that are being built in regional areas. 30 have been announced across the state, including metro ones, but 20 are still to be announced. But one of those locations announced for funding is at Murtoa College in the Yarriambiack in the west of the state. And there'll be 50 places for childcare made available there in Murtoa. It was identified by the Yarriambiack Council as crucial to getting more families back into work with those extra childcare places being made available. And according to the government, it says they're stepping to deliver unprecedented investment in early childhood education. We go now to South Australia, and Keith and District Healthcare has set to open with $9.75 million in the election commitment to the residents of Keith, the state's Limestone Coast, as Keith and District Healthcare formally has launched today, ending decades of uncertainty for the community, says the government. The new public healthcare model, which was endorsed by the community after extensive consultation, means the formerly Keith and District Hospital has officially joined SA Health and the Limestone Coast Local Health Network. The Keith and District Healthcare will reduce and prevent the need for inpatient care by introducing a community paramedic and nurse practitioner, while retaining and expanding services such as allied health, aged care, National Disability Insurance Scheme services and dedicated telehealth rooms. One of the 2 community paramedics have already commenced their role and are actively servicing the area. Existing hospital board members will formally transfer to the newly created Keith and District Health Advisory Council, and the new healthcare model has been designed following extensive community consultation. The transition of the Keith and District Hospital Board indicated that the frailties of the governance and the service model were unsustainable, as well as funding certainty provided by the Malinowskis government for this $9.75 million, and that is over the next few years. And it's important too to recognise our local health services, keeping those important health services and hospital services in our towns. And I'll be out and about visiting Keith over the next couple of days and other parts of the Tatiara, and we'll keep you up to date here on our regional news board.
A Flow News 24 update.